Hello, everyone, and welcome to ReviveHealth's Daily Briefing Live for April 27th, our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators dealing with COVID-19. I'm Jeff Spear, your guest host for today, and as always, we're joined by Chase Kleckner, Senior Marketing Manager at ReviveHealth, and our show's producer. Hi, Chase.
Hey, Jeff. Good to see you again.
You too. Happy Monday.
Happy Monday.
Week 7. And we're also joined by Samantha Pierce. Samantha is one of our lead media strategists at ReviveHealth. She's here to talk about what we're seeing and hearing from the media and what stories the media is looking out for from health systems right now. Hi, Samantha.
Hello. Glad to be back with you guys, Dan.
Glad to have you. Samantha and I were just talking earlier. I haven't seen each other in months, so kind of nice. All right, getting into things a little bit, here's the disclaimer part of the show. As with each show, we plan on covering the latest news on COVID-19 and how it relates to marketing communications, highlighting some helpful resources and sharing what we're seeing and hearing from Marcom professionals across the country. If you have questions, please put those in the Q&A button at the bottom of your Zoom. We'll use that at the end of the show to get through as many as possible. You can also use the chat function to talk to other attendees, but if you'd like us to answer a question, use the question queue only. And you also will see Chase will probably provide some links throughout the show in the chat function. You can also subscribe to the podcast on iTunes, search for ReviveHealth Daily Briefing Live. We will post a recording of this episode by the end of today, and you can visit our website, thinkrevivehealth.com/COVID-19 for that, as well as a lot of other content developed related to the crisis. And 2 notes, we are not expert on COVID-19, so this is not a place for medical or scientific advice or resources. We do have opinions on how marketers and communicators might want to manage the crisis, but everyone's situation is unique, and we know you've got to make the best decisions for you in your situation. Okay, so with that out, let's go to where we always go at the beginning of the show, the latest count of how coronavirus is affecting the country and the world. We use Johns Hopkins tool, and right now there are 2,995,000 confirmed cases in the globe, and we are at 968,000 in the United States. And we have surpassed 55,000 total deaths, 55,118 right now. It's a lot of people.
A lot of people.
Yeah, it's hard to see that number. So things are moving. Let's talk about a slightly different side of things today, and a couple news articles to bring to our readers' attention. One in Vox about the impact of people delaying care in primary care and other kinds of chronic conditions. Had a good article there. We'll talk a little bit about that. And then Modern Healthcare also ran an article about some claims data that has kind of borne out what we've all suspected about people delaying care. And I'm going to read a couple quotes from this because I think they're really, really useful if your system hasn't done this already. But this is from Cigna and claims from about 14 million commercial members they combed through, pre-authorization requests and claims for 14 million commercial members in the United States. So they found that hospitalization rates for atrial fibrillation decreased 35% over 2 months. Hospitalizations decreased 28% for epilepsy and seizures, 24% for gastrointestinal bleeds, and 22% for aortic aneurysms and dissections. These are some pretty big things, right? These are not small matters that should be, these aren't really elective procedures. So I think there's a really good quote from somebody named Dr. Glenn Stetton. He says, "We suspect that it's fear. We suspect that people are minimizing their symptoms and staying at home, or at least some people are, when they're really having serious symptoms that need to be evaluated emergently and could be putting their life in danger. Samantha, you're in the media all the time. This seems to be a kind of a different angle. What's your reaction when you hear something like that, those stats?
Yeah, I have kind of two reactions. I think the first is that just as a person and as a human, it's hard to know when it's safe to go outside. We're hearing a lot of different things at both the federal, state, and local level. And so I think that's causing some confusion for folks, not just patients, but I'm sure in the hospital marketer side, and just across the U.S. of like, what is safe to do, what is considered essential, what is a critical health issue that I need treatment for. The other thing that it brings up for me, Jeff, is the creative approaches that some of our clients are taking to help mitigate some of this essential healthcare services, and how do we still deliver those despite COVID right now. So a really great example of one of the ways that I think hospitals and health systems are pivoting right now is OSF Healthcare. So we've been working with OSF Healthcare, and they've got a partnership with the government, with the governor of Illinois, where they've set up this new pandemic health worker program, and it's designed for two things really. It's one, to monitor those patients that are experiencing COVID-like symptoms, and the other is for those patients that have more critical and high intensive care needs, suffer from those comorbidities that kind of need that ongoing care and support, but aren't sure if they're, whether it's safe enough to go into a hospital or not.
Yeah, that's really interesting. That I think that what you described from OSF is hitting this kind of area that is often neglected in today's discussion, but clearly something that they recognized early in needing to get out there and reach this population. There's another quote in this Modern Healthcare article I want to read because I think it's a source of optimism a little bit. Scripps CEO said that their cardiovascular institute volume had dropped 20%. But after the chief medical officer went on TV to assure the community hospitals were safe, they noticed a 40% jump in work. I think that tells us that communications is important, and that if you can work with your media, you can get some facts out there to consumers. Yeah,
that's absolutely right. I think one of the things we've observed over these, 6-8 weeks, however long we've been in lockdown for is the role of communications and that it can play, but more so, everyone kind of gets that. There's got to be communications that go out to patients and employees, but, where does earned media fit into this kind of COVID communications landscape? And it's actually, if you think back, for anyone who watched the earlier episode I was on, it was maybe at the beginning of this kind of COVID landscape, early March, mid-March, and we were all kind of in the beginning of our COVID response plan. Some states like New York were a little bit more advanced, but everyone was kind of just figuring out, like, what are their communications to their core communications that need to go out to their employees and their patients. But now, 6 weeks later, we're sort of at the point where everyone's got their essential communications out. And I think folks are starting to think about, like, what's next? And what role does earned media play? And I think there's a really great opportunity, and we've seen this from our COVID research that we've done and our survey data, that hospitals and health systems are an authoritative source and a voice that people trust, and it's a voice that they want to hear from. And the media is, constantly putting out stories about COVID, and so there's a really great opportunity to marry the education from these authoritative sources that people trust and the mass audiences that local media can reach in your community, and to not just inform and educate the community, but help people feel comfortable going back outside again. That example of the CMO going on local television and that increasing, utilization, it's directly tied to people feeling safe and wanting to, and being able to go out and get those essential care services that they need.
It's really interesting. We always know there's this balance in, I think, what people will do in healthcare. For a decade, we've heard people use the doctor too much or don't go to the right place. And then when we had a little more of a high deductible health plans, there was been evidence now that people delay care because of cost. And now what we're about to walk into, and we are in the middle of it, but it's probably going to get worse, is a newly uninsured or underinsured population. So I think there's a stat about 25% of the population generally is underinsured or uninsured. So that's going to go up.
Mm-hmm.
Fears about getting a virus, and really a lack of understanding of where to go seek care, what's important, and emotionally making a decision on, should I go to the doctor or not? Is this that bad or not? Is a really tough place to put a consumer, especially if they're worried about money, or just taking time off work or anything like that. I think this is, I think, a really big opportunity for health systems to use earned media.
Mm-hmm. Yeah, all the things you mentioned, those are, those are things that I think as people, we all have to be empathetic to, the different kind of experiences that people are going through during this time. But that same kind of thought, goes to working with the media too. So I think when we look at the stories that we're talking about to earned media right now, as we're telling these stories to them, and there's a lot of opportunities as it relates to COVID for people too, and I think it's something, it's a core fundamental, I guess you would say, for earned media is be human. But it's like the easiest thing to forget is to be human and to be empathetic, and to have that sort of language that understands that everyone's going through some sort of stressful experience during COVID right now, especially some of the healthcare writers we work with. I mean, around them, we're seeing layoffs, we're seeing pay cuts in their industries, and particularly the healthcare writers that we work with. They're kind of essential workers too right now, right? They're the ones that are pushing out this news 24/7. I think 6 weeks ago when I joined, we had been talking to Bloomberg, and Bloomberg said all of their staff were staying at home, except for the healthcare reporters and writers who were the only ones still coming into the office. So they've got a lot of coverage, a lot of news to cover, and not a lot of time. And I think the more we can be human and be empathetic to, our reporters that we're working with every day and be a resource for them, the better relationships we're going to grow. But I think the better stories we're able to tell for our clients, our health system clients, but better relationships long term that we'll be able to tell down the line too.
Let's talk a little bit more. I think you had mentioned, some media getting layoffs. So we've kind of seen this happen over the last decade or so, but it seems to be getting to another level right now. What do you think clients should be thinking about?
Yeah, that's a good question. I think a few big things stick out for me in terms of what clients should think about. The first one is, does your story have some sort of, the story you want to tell, is it related to a strategic business initiative? A lot of people, their biggest initiative right now is ease the concerns of people, and also, do the essential care and treatment that's needed. So if it fits into one of those buckets, that's a check. I think some of the other things you want to think about is, do you have a story or a product or a solution that's going to help, that's actually making a tangible difference right now into the COVID response? That checks the box, then we keep going. The third way to look at it is do you have something meaningful to share with your peers that they could benefit from, or the mass audience? Is there some sort of education component? Is there a feel-good story that's going to ease the concerns of, the worried well? But do you have something meaningful to share that's either going to make a big difference now or in the second wave? And I think that's those are three pretty big pieces of criteria that we want to think about before we do earned media.
So let's talk about kind of, what do you think right now? We've just talked a little bit about some stories that are meaningful to the communities or to national media. Maybe we start local, first of all, local and regional. What kind of stories? I can think through things like, well, states are starting to reopen. So if you've got, for example, an expert, most health systems do, an infectious disease, it's probably another good time to go around about physical distancing and precautions people can take because some people may have not been paying that much attention because they've been sequestered at home. So now they're trying to make those decisions. What other kinds of things can they do locally?
Yeah, well, I think local media is a really great opportunity because, again, you're reaching your core target audience. But I think there's even some national trade stories too, and I think what we're seeing now is an interest and a need in positive human stories. For every salacious headline or stat about another death or the amount of deaths in a certain community or how many people have been hospitalized, there's twice as many recoveries for every hospitalization, and I think those are the undertold stories right now. And for hospitals and health systems that may be thinking, all right, we've gotten past the core crisis time, and now we're thinking about what's next. Talking to local media or even beyond that, trade media, national media, is critical for building back that reputation or building back or maintaining that reputation and helping people feel safe to go outside and to come back into the hospital setting. Talking about being able to amplify the stories of all of the people, the critical care workers who helped that person recover, or what that recovery was like. I think what story that tells is, yes, COVID is serious. Yes, we should take precautions, but yes, we can beat it. And there's plenty of stories like that aren't being told. And I think that's one of the greatest opportunities right now.
Yeah, I totally agree. I think we need some optimism, source of optimism now. I also, again, like just thinking through local media, they're getting in different places now because they've told PPE stories. They've probably told the surge story. They've told the hero story. They've probably now thinking about on the healthcare side. Oh, and there have been some probably less, I don't know, locally, probably not so much, but the financial story for health systems.
Yeah.
I think if I were a health system right now, I'd be thinking through talking to the media about this is exactly how operations are going to run, and maybe taking them through the day in the life of if you have a knee injury, if you are feeling symptoms, let's go through the different pathways of what would happen based on the people that probably need care now, whether it's chronic care, surgical care, or some emergent thing that happens, so that the consumers in that region really know what the hospitals are doing because they've never thought about it before.
Yeah, I think it sort of follows, if you think about, this is what's happening at a federal level, right? It's like, how do we start to open back up the U.S.? And then each state is starting to look at, how do we open up our state? And each city within that state is, how do we open up our city? And hospitals have to be taking that same approach, is how do we open up our hospitals again, and how do we get people safely back into here? And what are the steps that they're going to need to take? What's the information that they're going to need to know? And that's a great opportunity, as you mentioned, Jeff, to partner with your local media stations, because they're starting to think about that too. What are the stories that they have to tell next? And those stories are going to be, how do they get people back out into the population and taking advantage of all of the open businesses and the services, and how do we make them feel safe doing that? So it's a really great opportunity is to leverage local media to do so. I think you would find that a lot of local media partners would be really interested in telling those stories too.
One of the New York Times does a really good job in some interactive pieces. They had a piece 2 or 3 weeks ago that was very visual, that showed how basically germs spread, cough or a sneeze, and what 6 feet actually looks like. I think those are the kinds of things that might be useful now for local media to talk through, but also go through if I was a health system, pushing the same kinds of things we used to push, but people don't stick. It doesn't stick with people. Urgent care versus primary care versus ER care. May also need to get your communications ready about how you deal with financial assistance for people that maybe can't afford to pay. And I think right about now, if you haven't done it yet, people will maybe start getting bills in the next month for having COVID treatment. Those people that that you say have recovered already. And I think this is still a big question mark, or what are health plans going to do? What kind of bills are they going to give people? And therefore, then what's the hospital and health system and the care provider? Are they ready to answer those questions?
Yeah, those are the next headlines I think we're going to see, and hopefully, my hope as a kind of where I sit in the media strategy and PR side of things is that just as many of those stories as we see the positive human interest stories and the stories about the good work that's happening and the ways that communities are rallying together, because there's just as many, if not more, of those stories too. So while we know those things have to get covered, and advice for those businesses that are going to be going through some of those things is just to be as transparent and honest as possible when dealing with the media. But make sure you have a solid plan. Talk to your internal comms teams. Talk to your leadership teams about what is that information that you're going to have to communicate to open back up, and create a sort of framework of like what's now, what do they need to know now, and what are they going to need to know when we open back up in 6 months, and what are the steps and the phases in between there that are going to help us do it. And that they're going to need to know to be able to take advantage of those services.
Samantha, put you on. Oh, go ahead, Chase.
I was just going to mention a story that I think is relevant right now, or is relevant to me at least. Like, my sister is about to have her third child this week.
Congratulations, Uncle Chase.
Very exciting.
Yeah. But and then we also had one of our really close friends just have twins last week, and there's a story there, right? Like, I think especially thinking of my sister, she's actually rather fearful of going into the hospital and catching something, and what does that mean for her and her husband and all of that. But like, my friend that had their twins last week, amazing story about their experience, about how it actually felt relatively normal compared to kind of their first time that they had their first kid. And I just think there's just kind of those average day stories that that can really contribute to the reputation of a hospital, and really kind of say, hey, it is safe. Like, I mean, there's not much more safe than like having a kid in a hospital, right? Like, and being able to tell that healthy, good story, like, to me, I think there's something there to continue to kind of tell the good stories that are happening amidst COVID at a health system right now.
Yeah,
Great
that's
point.
exactly it, Chase, is how I'm sure you shared that experience with your sister. And, I'm sure she still has some fears and concerns, but I'm sure that hearing that story also put her mind at ease. And that's exactly what hospitals and health systems, that's their opportunity to work with local media to do the same thing.
Yeah, absolutely.
Yeah, don't underestimate, I guess, the blocking and tackling and the basics. And sometimes it's easy to forget all that stuff, but this is really smart and kind of foundational public relations work. Samantha, putting you on the spot, what some national media outlets that you like and how they're covering COVID or not? Maybe don't say those, but what have you seen that's a really good source, and maybe even good inspiration for hospitals and health systems to take a national story and say, hey, I like how they did that here. I could probably work with my local outlets to do it. Or if they want to get national, who do you think is providing good, fair coverage?
Yeah, well, I have to echo your sentiment about New York Times. I love the way they tell these kind of like digital stories. They're the best that I've seen do it. But I think Vox has been a really great source for healthcare over the years. I was telling you guys right before we joined that Vox actually has a new series that they're producing for Netflix, and it's Coronavirus Explained. And so I think Vox has a really smart coverage, but they do it in a way that it's got the science and the technical aspect, right? But it appeals to a mass audience. So it's something that you and I can consume or want to consume on Netflix. So I really like the creative storytelling that's going on across the national media. I think local media, you want to just think local, right? So again, what's happening in your city? What are your patient populations need to know? And just if you have an idea, you'd be surprised. Call up a producer, call up your local editor, and pitch them your idea. I think now is the time to be creative. Now is the time to take advantage of the opportunity in the space that's all COVID right now, and to really establish some leadership in your local market if you haven't already.
Great. I I think for everybody here, you've heard a lot of good tips here, a lot of things to remember, but the next 4 or 5 weeks, the consumer stories, the consumer education, the media education. One thing that we didn't get too far into, but most people know the the level of knowledge that journalists have of the healthcare system, of how hospitals and health system work, varies quite a bit. And especially if you've got reporters that maybe they're picking up a new beat because this is the hot topic. Remember, educate them, brief them, don't take anything for granted, but use this opportunity to explain how you work, why you're working in the way that you do the operations, and just be ready for those questions. But get out there, tell your stories, the good ones and the ones that are educational, so that the people in your area know how to get care, when to get care, what the best way to do it is, and certainly don't ignore some potentially serious health conditions that they really need your services for. Okay, I think that's it for today's show. Samantha, thank you very much for joining us.
Thanks for having me.
All right. And as always, Chase, thanks for joining us in the nice stories about Uncle Chase coming.
That's right. Absolutely. My pleasure.
You have to show pictures during the next one of the next daily briefing live.
We will. We'll make it happen.
Great.
All right.
Chris Bevel will be back
you guys.
tomorrow. Don't leave yet, Samantha. Chris will be back tomorrow alongside Sasha Bogosian. Sasha's a executive vice president here and lead strategist at ReviveHealth. They're going to discuss some recent, just occurred qualitative research digging into consumer concern coming back to hospitals and what we as health system marketers and communicators need in order to do to get them to come and make sure that they feel safe. So this is building on some research we already did and is more specific to messaging and things related to coming back. So it digs deeper. So you don't want to miss that. That's tomorrow. Remember to visit thinkrevivehealth.com/COVID-19 for recording of today's episodes and other content. You can also subscribe on iTunes, and remember to let your teams know about the podcast. To all of you out there, hang in there. Keep up the amazing work. The skills you bring as marketers and communicators are critical in helping us all move through the crisis. We'll be back tomorrow and every weekday until this passes. Talk to you then.